There is some positive news on the overdose crisis front. Emergency department visits across the state have dropped 31% so far this year compared to the same time last year. WRAL's investigative data journalist Ali Ingersoll brings us an inside look at a local lab working to learn what chemicals are actually being sold on our streets.
This lab here at UNC is the first of its kind. This machine here takes street drug samples from all over the country, analyzing them to figure out what exactly is in them in hopes to help communities save lives.
This is supposed to be cocaine, fentanyl with xylazine. The amount of substance we need is really small. It's less than a grain of rice.
Scientists like Dr. Nabarun Dasgupta then run the samples through this machine, and 20 minutes later, a chart like this is generated, showing the chemical makeup of the sample. The lab works with nearly 200 public health organizations, including 34 from North Carolina.
The drug supply is something that seems very complex at first, but once you actually use science to understand it, there are clear patterns both geographically across the state, but also within substances.
Since 2021, the team tested more than 5,600 samples, identifying nearly 300 different substances. Robeson County harm reductionist Carissa Collins-Caudill has sent about a dozen samples to the lab and says she's seen people change their using practices after getting back results.
There's a misconception that people who use drugs don't care about their health. But if you give them the opportunity to make more educated, safer decisions, they'll do it every single time.
Dasgupta feels that incorporating science into the public health approach is a key piece to tackling the crisis.
Normally, we don't find out what's in street drugs until it's too late, when people are either dead or they're arrested. There's no opportunity for prevention. There's no opportunity for recovery.
And the program continues to grow as there's more interest from community partners to understand what the drug supply is like in their areas. In Chapel Hill, Ali Ingersoll, WRAL News.